welcome to today's webinar, which is Freelancing in Medical Writing, an Ocean of Opportunities. So, the speakers for today's webinar would be myself and Dr. Namrata Singh. Dr. Namrata is the founder and director of Turacoz Group. She is a pediatrician and also holds an MBA degree. She will introduce herself more while she is presenting the session. She'll be presenting the second part of the session. And Dr. Namrata, would you like to speak anything over here?
No, just a very warm welcome to everyone, and it's a very interesting topic and a topic which is very close to my heart because I started as a freelance medical writer, and then became a medical writer full time, and then eventually opened this company. So a very interesting topic in today's time. So over to you, Neha, and I'll again come on the screen once I'm presenting my part of the session. So over to you, Neha.
Yes, thank you so much. So let us go to the session. Today in this webinar, we would be covering about freelance medical writing and its career opportunities. Then we will tell you about some steps that you must take if you want to enter the industry. We'll give you some tips that will help you get started as a freelance medical writer, and then some details of a workshop that has been planned by Turacoz to help out all those who want to join the freelance medical writing industry but are somewhere or the other lacking the desired resources or maybe the information to get started. And then we will end this meeting with an open question and answer session where all of you can get your queries resolved. So let us begin this exciting journey, and on whichever projects they want. They have the flexibility to choose the type of work and the type of industry they want. Now, when you're working as a freelance medical writer, you have to market yourself. You have to become a salesperson. You have to network for that. And at the same time, you have to manage your accounts as well. Now, along with being a writer, you also need to take care of the review and the QC part, the quality control part, or the quality check part of your documents. Now, these are all the different roles that you also play in addition to being a medical must be self motivated. You must take initiatives. Otherwise, you cannot establish yourself in the industry because ultimately you have to look for the clients. The clients are not going to come to you, of course, unless you are a well established, reputed freelancer. So you need to be proactive. You need to have your online presence. You need to have a good profile, a good portfolio. Now, all these points will be covered by Dr. Namrata, and you have to work according to that. Then, as a freelancer, your salary would be based on projects, the number of projects, type of your audience. So, medical writing requires knowledge in both writing as well as science. It is a combination of a writer's creativity with detailed processes of there has been a tremendous growth in research and development industries, and the pharmaceutical companies have been investing more and more in this sector. There have been surges in the number of clinical trials. There have been updates in medical devices.
Your time selectively on which activity you're spending your time on. Now, who hires freelance medical writers? So, like any company, and it's majorly they are more, either they are service providers or their agencies or their research institutes or maybe some individual doctor touching on something which is very controversial. And what rate and how do you decide your rate? So this is, I'm going to address the elephant in the room at the beginning itself, that when we say that we want to work as a freelance medical writers, especially when you are entering into the field, and you're new to things around you, you really don't know how to place a value on your activities, on your tasks, and how do you do the negotiation. So there are a couple of surveys which were done on international medical writers. We do not have any similar kind of survey which has happened in though there are some surveys which are ongoing, but not in the Asia or the Asia Pacific or other developing regions. For a medical writer, I would, this is another survey which was done in 2020 21. I'm also one of the authors in this survey. We had a and this, mind you, the survey was conducted only on EMWA members. So you can see that, it's a very small size. And out of the MVA members, there are about, I think, 1,500 MVA members, around 400, 500 people filled up the survey. So it's a very small sample size. So, like, when you're seeing these results, you have to take that, with a pinch of salt. So the average starting that, what option is it, and how do I get into it? Now, what's very important here is, medical writing as such in general is a very vast field. You can write for a doctor, a healthcare professional, a nurse, a pharmacist, patients, consumers. You can write for maybe some specific what you have been educated in, because then you become a subject matter expert. You can review documents which are written, in that topic, in that domain. Or writing, then you can also write like manuscripts or slide decks, whatever, you are. So one what I would have done that time is, I don't know the topic, I don't know what type of document is, it is, let me just leave it and not attend the event. But then I thought that, I have to start from somewhere. So I traveled to Bangalore for, I think the workshop was for 2 days that time. And I was attending the sessions. The sessions were somehow, they were just going over my head, and I was just not understanding what they're discussing. But yes, it was interesting, and I wanted to learn more. But the biggest, I would say, the advantage of this event was, I met someone there who was working in a medical communication company. He was a medical reviewer there, and they were looking for freelance medical writers. So I just approached him. I asked him that, if I want to become a freelance medical writer in your company, what do I do? Investments are required. Now, where all do you actually invest in? So hardware, have a good, computer, printer, scanner, sometimes a second monitor, because you are working on documents, you may be working on multiple documents. So attach a monitor with your laptop and just see, that how it helps you. Then so become a author if you are, kind of, you've been a part where the data was collected or it was analyzed, or suppose it's a paper on medical writing and you have experience in medical writing, then obviously you become an author there. But if it is about a disease, about, somebody's clinic's data or any such thing, obviously you cannot become an author in that case. There are certain guidelines which are there, so you can just refer to uh, ICMJE. I'm just going to put it in the chat box. And what kind of posts to write? The post would be, anything related to how you want to present yourself. It can be, and see, when we are talking about post, when we're talking about blogs, what I've seen is, it has to have kind of a story around it. It cannot be too technical, and it cannot be too light. Okay. So if there are no further questions, thank you so much.